Let's get started, shall we? I'm Dr. Ranjan Ghosh with Good Karma Education. Today we are going to be talking about, I think that's too much glare. I think I'll just go without. Today we'll be talking about psychosis and how you can become psychotic. I really do feel that this class is an important and serious one because we sometimes mislabel people and there's some sort of stigma that's associated with psychosis and an ability for you to maintain your mental faculty or sanity. So, what we'll be discussing today, why I phrased it in these type of ways is because of incidents. Why my pet peeve will be coming up here today, but first we'll talk about mood disorders and their ability to cause psychosis. Second, we'll talk about dementia, as well as postpartum psychosis, delusional disorders. Then we'll get into the schizophrenic form, schizophrenia, schizoaffective disorders. Then organic causes or medical or medicine or illegal drug causes of psychosis. So buckle up. It's going to be an interesting ride today. Um, yes, this just briefly sums up what I was discussing in my point of view. If we are actively looking to reduce and eliminate stigma, we must understand and diagnose appropriately. The patient will still be the patient to me, but we must diagnose and understand their illness. Otherwise, they won't be able to even try to understand their illness, and then thus making it so severe to obtain and get proper treatment. So as as we progress and we look at this thing logically, obviously when you look at prevalence and incidence, the prevalence of mood disorders and the prevalence of drugs are far more than schizophrenia. So stop calling people schizophrenic when they have psychotic symptoms. The disorder of schizophrenia is a very serious one, as we'll find out today. And I really want people to be appropriate in their diagnosis to give people the proper hope and treatment and the proper communication between providers. So again, we're going to be defining these things. We're going to try to you know, seek care and break the stigma, just like in this quote here. Due to societal perceptions, patients don't seek care. Unfortunately, that becomes fixed and alters their perceptions permanently. This I remember happening all the time in our chronic mental health clinics. We were able to identify and then follow the patients around because they would not seek treatment. So non-compliance was a big issue in schizophrenia and psychosis because of that impaired reality state. Now, when you look at other symptoms of psychosis, we are looking at the first initial ones are pretty much delusionary. So what do I mean by delusions? I think the main thing now is to discuss the subtypes of delusion, which is going to be a question at the end of this sixth series. I wanted to also state just a congratulatory news. We'll be doing this series also with Jadavpur University's counseling department. Just got the word. I'll be continuing as an associate professor there. So you'll be able to hear these lectures as well during their programs. So let's go for a delusion subtype. I feel like this is something we should be talking about and actively understanding. let's put this up on the board. Hold on one second. These are the signs of schizophrenia. We're jumping the gun here. Just oh, right here. Thank you. So the four types. I just wanted to be on screen for everyone. The first one we discuss pretty often is erotomanic delusions. Typically in India, this looks like older wife accusing the husband of sleeping with the maid, or it could be various things like people actually feeling like their spouse is cheating on them, and they're having that feeling no matter what. They can't shake it. It's just not out of insecurity, it's out of delusion, impaired reality setting. The other one is a grandiosity, which we know very well from bipolar, right? In the upstage, we have grandiosity. In the low stage of depression, we have low self esteem. So the compensation of grandiosity is a delusion where you think you're bigger or better than someone. You can even think up to that you're God. So we have many people that have come into the emergency rooms thinking they're Jesus Christ in the US, and then taking a shot from our ER department in the psych department, and then them feeling within a day that 12 hours, I should say, that 6 to 12 hours, that they're not Jesus Christ and they can go home normally. The next one is the jealous type, which is again suspicious, jealous. Those things are like ingrained in our dopamine system, where we want to be better than someone else and we cannot be. The next one is persecutory type, where you think that everyone is ganging up against you. This is like when you feel like people are out to get you, they're running to come and get you, all these things. Then the somatic type. The somatic type, what we see here is you always feel like there's a medical problem happening. And there is, actually, because our brain is very powerful. It controls our stress hormone, cortisol. So that type, it's very common to us, at least we see cortisol being used a lot in regards to releasing when we have these somatic type of issues. And so we're feeling this, and we're feeling that we're almost sure that we have this, even though it's impossible. Then we have mixed types, we have bizarre types. There's all kinds of delusions types. Delusions of reference are very common, which is like you feel like the radio or the TV is talking to you. Um, Various other delusions are there. We'll go through and discuss some of them here in a bit, but these are the ones I wanted to highlight for right now. They'll be on your questions. So let's talk about true causes of actual psychosis, or the paths to psychosis. The first one being substance induced psychosis. Why do I pick on substances very quickly? I am saying substance induced psychosis is common because we're not aware of the things that we're putting in our body or into our system. If you are aware and you know what it does to you, then you should be very cautious. Am I correct? Everyone's following? Psychotic events could be avoided, right? So understand what your substance you're doing, what it is. Please understand how it represents acts in your body, and if it's making you psychotic or not. Next is bipolar disorder. Hold on one second, please. In bipolar disorder, we have the situation where mania, it's a slow progression, where mania leads to psychosis. So that whole thing about impulsivity, anger, euphoria, grandiosity, then auditory hallucinations, and then command auditory hallucinations, and it's very, very dangerous. So that is the most common cause, I feel, that I see coming into my office for psychotic disorders, not schizophrenia. So that misnomer, that misdiagnosis, we're going to clear up today. Schizophrenia is on the next slide, but I want you guys to understand a person that is functional, that has mood changes, that can take showers, that can go and get up and go, is not schizophrenic. They're most probably bipolar with psychotic features. And then we gauge what their episode is. Make sense? Okay. So that's because the prevalence, right? We'll get into prevalence stats here in a bit, but prevalence is higher of bipolar, even though we don't like to admit it in this country, that it's definitely higher. Then schizophrenia, even though the word is loosely used here, everywhere. Okay. So dementia, I think you guys know what dementia is. Dementia is like an impaired memory, an impaired cognition due to acetylcholine esterase deposits in the brain, in the basal ganglia. There's many other things that happen with these neurofiber triangles that are in the brain, again, that we see on autopsy. But again, this is hereditary sometimes. There's hereditary is Alzheimer's, there's vascular, as well as many other rare ones, and now not so rare ones like Creutzfeldt-Jakob and all these other ones. And the next thing is depression can make you psychotic. So depression, even the slow way, it takes longer. That's why I'm saying the incidence of bipolar mania can get to psychosis quicker. That's also a question. But depression can also lead to psychosis. It just takes longer. So psychotic depression. So if it's in a bipolar person, I think this is the reference point for that intern who made these slides. The psychotic depression here is an agitative process. It's someone who's delusional and having perceptive hallucinations, as well as suicidality or depression. And we'll get into the definitions of all those, but these are the most common types. Now we're getting into the uncommon, but the ones that you have to learn for your various tests and boards. and actually should know, because there's a huge population in India that have this, but that it's uncommon comparatively to other things. So schizophrenia is a disorder. Psychosis is a symptom. Within psychosis, the symptoms that we have are delusions, which we just mentioned before, which again, I'm not telling is a question, auditory visual hallucinations, right? And then the disorganization, which we can see in this picture here. So this would be a schizophrenic patient. A bipolar manic psychotic patient would write close together. They would be journaling. They might be writing very precisely or clear or very fast. But this is a system, a disorganized system and pattern this schizophrenic person has put up. So let's look into the definitions of schizophrenia. Sorry, let's grab this one. Yes, finally. So we talked about delusions. We talked about the four main types. There's also one type I didn't want to forget is the hyper-religiosity of delusions. That's a very common one. Also a question, because I always say, when religion is not comforting and not supportive, then why are we doing it? Remember that. Then is it crossing over into impaired reality? So yes, hallucinations. The scariest thing for a psychiatrist to face is someone who's actually having command auditory hallucinations. What are those? Those are someone telling that person to do something, either kill themselves, kill someone, and the method in which to do it. That is an extremely scary process and extremely difficult to take while you're treating it, because again, they're very impulsive and it could happen at any moment or any time. Disorganized speech, we talked about it, whereas a bipolar person would be very precise, crisp, and clear with their speech, very articulate, very smart at times. This would be very disorganized, low IQ-ish almost. High IQ, but disorganized, like it's bits of pieces. but not actually put together parts, um, and grossly disorganized. Now we'll get into the main difference, which are these negative symptoms. Negative symptoms sometimes get full, like kind of, we have to really tease between that and a mood disorder. Which mood disorder? Depression, because this person is amotivational, avolitional. They just, they're not moving based on what they want to do. They're just moving and slowly doing stuff based on what the disorder is making them do. Catatonic behavior is just the same thing. But negative behavior is lack of hygiene, not taking showers, staying in one area, very isolative. Again, very much can be mistaken for depression, but it's in a different extreme quality. So please understand, when you have these type of difficulties, you understand that there are helpful sources that can bring these things down, that can give you an actual understanding of what's happening. The next thing here is, let's get off this slide. The next thing I think here is schizoaffective disorder or schizophreniform disorder. So, what does it take to diagnose schizophrenia? We went over the criteria of the negative symptoms and the positive symptoms, which consisted of all those symptoms of psychosis, right? Delusions, hallucinations, and disorganized thought. Now, the negative symptoms have to be there. And if they're there together for 6 months with the positive symptoms, then we think schizophrenia. Less than that, we think schizophreniform. Lower than that, we think brief psychotic disorder. So that's how it goes. 1 day, brief psychotic, more than 1 day, brief psychotic, schizophreniform to a month, and then schizophrenia, 6 months is the definition. You have to watch. So again, please be careful on these. These are questions on the test and board exams. Schizoaffective disorder, though, is very interesting. It's kind of a confusing factor. Remember, I said that bipolar, you're amping up, you're becoming psychotic, like this, right? Progressively with your mood problem. In schizoaffective disorder, they switch, they alternate. So you have psychosis, but never at the same time as your mood problem. And then you can define that as schizoaffective disorder, either if you're a depressed type, bipolar type, or mixed type. So, or undifferentiated. So here's the thing: schizoaffective disorder, mood symptoms are happening, but they're totally different than psychotic symptoms. Bipolar, they're happening together and getting worse together. So that's the difference. Um, Organic psychosis due to general medical condition, that's, stroke, brain trauma, again, any type of brain tumors, intraocular masses. I'm sorry, intraspatial or intracranial masses. Any of those kind of like lesions or tumors or seizure disorders or anything neurological in that way. But again, that's our job to know that and when to refer for that. And that's why you need a doctor MD to be on staff for these things. Looks like there's no questions. I'm just going to go on through. I don't see my budding interns. Maybe there's some technical glitches, but this one was for them. So don't be psychotic. Tips to stay away from psychosis. Understand and know what you're putting into your body. Know the stuff. Know the things that are going into your body. Don't just take someone's word for it. Understand what you're doing. Certain withdrawals could be dangerous. If you drink and do benzodiazepines, the withdrawals of those are sometimes life-threatening. Remember that. And they lead to psychosis as well. Extreme of it, withdrawal of it as well. Sleep and exercise is the key. I want you guys to understand that the number one thing you can do to improve your life is to sleep well. Yes, you exercise and you sweat every day, the 5 ways of wellness, as we'll discuss throughout this lecture series. Yes, of course it helps, but the number one thing is sleep. And percentages. So 0.32% of the population, 1 in 300 people worldwide have schizophrenia. That's approximately 24 million people in the world. Okay, right? It's not as high as other mental health disorders. It is very severe. It is a severe disorder. It's a serious disorder that we have to take atypical antipsychotics to treat. And after treatment, we have to render if that person would need to be on those medications forever. Not like bipolar, again. So why do I say bipolar? Bipolar is the number one cause of psychosis. Because of the sheer numbers, I guess. So, like I mentioned, it's the quickest way to get psychotic. Not depression takes a longer time. Therefore, 24% prevalence rates. I'm sorry, 2.4% prevalence rates in society is about, in 11 countries, they're saying around 40 million people. And in that 40 million people, 24 to 25% get psychotic at any given time. So you can understand the numbers are working in the favor of bipolar disorder. And lastly, if you experience psychosis and you want an outlet and you need someone to understand you and you want conservative medication management, please visit us at Good Karma. Otherwise, visit someone that can give you the care you need. It is very scary to have a psychotic episode, irrespective of the path you have it in or how long it lasts in your body. Please seek care. We want all of these things to get better, not worse. This is Dr. Ranjan Ghosh with Good Karma Education. Please visit us on at Good Karma Mental Health. But we often forget this. But I want to remind everyone to think good, do good. Take care. Have a nice day. Take care. Have a nice day.